So yes, I'm the Assessment Director for the Department of Family Medicine, and we do have brand new this month, our new field notes, which are, we've had field notes for many, many years, but for the first time they are electronic and, and tied to an EPA dashboard. And so for those in the audience who are our family medicine preceptors, you have been hearing about this, and lo and behold, here they are, and our residents have been just oriented to this new format. And so field notes in family medicine are to provide and document mainly formative assessment and feedback, as mentioned, to map onto our EPA dashboard to help with educational planning, and now accessible on mobile phones, laptop, and desktop. And as Heather mentioned before, it's good to have conversations with your resident or your learner so that before you embark on assessing virtual care, that you have a good mutual understanding of a number of issues that she and also Ted and Zena have elaborated. So certainly understanding what their experience has been with virtual care and their understanding of it. It was mentioned before about determining the appropriate level of supervision, from hands-off to complete direct supervision, and whatever would be appropriate in between. The approach to supervision is certainly important. Whether you are doing some sort of three-way communication, as Ted and others have spoken about, whether it's with a speakerphone, conference call, three-way video, or whether it's case discussion, or whether it's a chart review. It's good to review with the resident about things like consent, privacy, limitations that are inherent to virtual care. And certainly reviewing their presentations and documentation are all good things to have a mutual understanding so that it sets up for your assessment. And so I thought I would just briefly go through 4 tips that we have for field notes, which really apply, well, it certainly, as mentioned, much can apply for in-person as well as virtual care. These tips are more geared towards virtual care because inherently there are certain aspects for which we can give comment. And our field notes ideally are done in a timely fashion, are quite clear, specific, focused feedback to the learner. And so the first tip for doing assessment or field note in virtual care is really to make comment about their safe, effective use of the technology. Have they used the platform skillfully? Did they assess the patient themselves for use of the technology? Did they review consent, the limitations, privacy, confidentiality? Were they creative? Did they get other data, such as maybe email, or maybe emailed forms, or had questionnaires? Are they looking at the background environment in a video call? Do they have the patient take vitals and they use that information? Do they know about appropriate prescribing practices in virtual care? So these are all things for which we can make comment and complete a field note or provide formal feedback for our learners. A second area that we can provide feedback is really on how do they adapt the communication to the virtual visit. Do they establish rapport well? Are they introducing themselves appropriately? Because they may be acting differently than they may in person. As mentioned before, are they looking for, listening for verbal cues? Are they asking clarification questions? And when they document, do they actually document things like consent or privacy or limitations? Do they actually document rationales for maybe deviations from typical management due to the COVID-19. Maybe it is you are deferring certain tests and going empirically because you don't want to bring the patient in for this test or that kind of assessment. So, and if they document that, that is something, or don't, that is something for us to assess as well. A third area that we can assess using field notes is really their adaptive clinical reasoning. As mentioned before, virtual care may or may not be appropriate, and that is a bit of a judgment, and we can help gauge along with the resident whether that is actually appropriate or not, and whether they feel like an in-person assessment is required. Are they asking probing questions that help to triage whether that needs an in-person assessment? Do they get a sense of the severity, particularly when it's over the phone? It's sometimes hard to know without actually asking very direct questions. You can make comment as well whether the resident has facilitated safety and effective care dependent on whatever method that they have, and that they might want to attend to potential biases that we have, well, in virtual care, also with the pandemic. So, just as an example, that they're not attributing, all coughs and fever to COVID-19 specifically, or other things, other biases that in the strange times that we have that are inherent to what we're doing. And a final tip for field notes or for feedback in virtual care is really to assess the learner's situational awareness. Have they really adapted the management and follow-up to the current context, such as, what labs are open? Do they know how to get the requisition to the patient so they can effectively do whatever it is? Is follow-up made virtually? Is it a follow-up an in-person thing? Do they give red flags to the patient? What are future plans? And have they really modified them because of specific patient factors? These are all things for which we can give assessment and comment, and our field notes in family medicine are the mechanism for this. And just as a simple example, so say you have a new PGY1 who assesses a woman who has a urinary tract infection, and it's on a three-way video. You may want to observe whether the resident has obtained some consent, discuss limitations and privacy. Do they know how to prescribe things and document things properly? And you may want to give clear, specific messages, such as, you helped ensure that the patient understood the technology, how to use it, about privacy and so on. You may comment about the fact that we discussed that we are going to forego the usual testing given the circumstances and typical symptoms and treating empirically. You may comment that is something that you did an assessment, this was appropriate to do virtually, or you could give comment on things like, I noticed you didn't really give red flags or other reasons why she should recontact us. And those would be examples of things that are given on a field note in family medicine. So I thought I would just share those simple tips, and certainly, as mentioned before, I think with creativity, virtual care definitely is not different than in-person assessments in that we can assess our learners and give comment, and really important for us to become more and more comfortable with this format so that we can help them along as this goes on, well, on and on. So thank you.
Thank you so much for those practical tips, Joe. That's great in terms of helping our family medicine learners and all learners with respect to feedback. If we sort of change the focus now and move over to the Royal College side, we're going to be joined by Dr. Haroon Yusuf and Dr. Lisa Koliza, who are going to talk to us about some of the tips and tricks for the Royal College assessments.